Tell us a little bit about your interest in the concept of a trial of some sort.
In my clinical practice, I'm seeing a lot of patients who otherwise are candidates for statin therapy expressing a reluctance not to go on statin treatment and looking for ways to justify not being on statins. And I was looking into this whole idea of using coronary calcification assessment to assess whether the patients who are otherwise high risk based on traditional risk factor assessment like the Framingham risk score or the pooled cohort equation. Could we identify a subset of individuals with a coronary calcification of 0, identifying low atherosclerotic disease burden? Could these be the patients where we could comfortably not put on statin therapy, even though they were eligible for statin therapy based on the guideline recommendations? So that's where it got me interested in thinking about using coronary calcification of 0 to de-risk and therefore to de-escalate therapy.
Yeah, that seems counterintuitive almost. I don't know that I've ever heard of a scientific trial to find that population that should not be on medication. Is that pretty unusual?
Yes, it is, because even if it is not pharma sponsored, the default position is are we undertreating individuals? We don't want to take the risk of undertreating. We want to find individuals who may be at low risk based on other risk estimates, but perhaps there's a subset of there that may actually be high risk on the basis of any risk factor assessment like coronary calcium and escalate therapy. That's the default strategy, which is what the guidelines have also recommended. So if you have an individual which does not meet the threshold for statin treatment, you could use a high coronary calcium score to make them statin eligible. So that's the default intuitive approach. But the reality is that people don't want to take these medications for sometimes nuisance side effects and sometimes truly impairing their quality of life. So somehow if we could figure out if these individuals are not at high risk, maybe they're truly low risk, perhaps we could spare them treatments that are associated with side effects, and then there's this issue about cost and other things, and that perhaps might be a way to go. What is interesting is that people have already embraced this approach in their clinical practice without any trial evidence to support this approach, and I think it would be a good opportunity to try to sort of explore the possibility of using a coronary score of 0 to de-risk and de-escalate.
We're anticipating with fingers crossed the possibility that maybe some funder stumbles across our website, sees this video, maybe watches Sanjay, and they want to know what's the compelling reason that they should part with their money to help to fund a study like this or a trial like this?
Well, I think there is a societal need to responsibly allocate resources. And when we say de-escalate, it doesn't necessarily mean treat or not treat. It could also mean that we don't utilize further testing, which in of itself is expensive. Perhaps if we can do that and responsibly utilize precious resources, I think that would be to society's benefit.